MC Misra for this event, and welcome our guest of honors, Jatinder ji from PSD Chamber of Commerce, Mr. Anil Jauhri, former CEO of NABCB Quality Council of India and internationally renowned expert on quality and accreditation. Our chief guest and chair of technical committee, Dr. Arati Verma, and our special guest, very special guest, for the second part of our event, Ms. Rupal Sinha, who is the CEO of Quess Corp IFMS in Bangalore. So, and all the dignitaries, the participants who have joined in here on this occasion, I welcome you all for this event. Thank you so much for taking your time out. I know today is very busy day for everyone for their own reasons, but for us, for accreditation, it has been a hectic day since morning. Several back-to-back programs were lined up. So thank you so much for taking your time out and making it happen to join this training program. With this, now I would like to request our chairman, Professor Misra, to give his opening address, please. Floor is yours, sir.
Thank you, Dr. Rana, and I must congratulate UAI and yourself, the team that was involved in this accreditation process. These are difficult times for everyone, but I think we have to move forward. Any service organization will have two very integral components, quality and safety. And during this pandemic over last 15 months or so, the industry and all other businesses have been severely adversely impacted by obviously now that by the end of this year we would have vaccinated large population, and we expect that 2022 would bring a lot of good news. As we all know, the QAI has developed a set of accreditation standards incorporating best practices and guidelines available in the hotel industry as well. Although they were doing their hospitals, clinics, and many other like dialysis units, IVF centers. So this is a very welcome step, I must say, because recently during the pandemic, the hotels have also been used as isolation places, as a quarantine centers, and even home quarantine facilities were provided, and also some treatment. So standards are used naturally, basically as a framework to achieve our goals in different areas, whether it's hospital, industry, and there is nothing which is exception. And hospitality industry more so is like basically as a in a lighter vein. I once mentioned when we were discussing the preparations for Commonwealth Games in 2008 and 9 before they began in 2010, where the MEX group was just coming up. So what in a lighter vein, I mentioned to Mr. Anil Singh that you have MEX is like a hotel Hotel obviously we pay, so we want quality, and we cannot do without the processes, the structure, the safety, and the quality to be anyway down. In that direction, I again congratulate Dr. Rana, who has taken this lead, and also those who have been coming forward to have these accreditation standards implemented and getting certified. I think the time has come. The quality has to be uh, on the topmost priority. So thank you so much, Dr. Rana, and I request you to move forward on the program. Thank you.
Thank you, sir. Thank you very much for your wise words and encouragement about adoption of the standards to improve quality and safety. It's not just healthcare, but it's other industries and sectors, including hospitality. And very well that COVID-19 has taught us all how to go into new areas and innovate, and how the hotel has been converted into COVID centers. So thank you so much, sir. And with this, now we move forward to the agenda, and I would like to take permission from all of you to share my screen to take you through a brief introduction of the QAI and accreditation standards, which we are aiming to launch today. Just give me a moment. Okay. I hope my screen is on up on your screens.
Yes, yes.
Great, thank you so much. So today we are on the occasion of launching accreditation standards for hotels and homestays. And briefly about QAI, we set up QAI as an accreditation body in August 2017, and we are the fastest developing accreditation body in the world, which is evidenced through a number of standards which we have developed in just 3 years, around more than 10. So we have not seen that number of standards developed anywhere in my experience over last 15 years. This is our organogram. We have a set of advisors, and we have 4 verticals. One vertical takes care of education, training, facilitation. One vertical for healthcare accreditation, as chaired by Professor Misra on different things, and I will share with that the activities. One is for laboratory accreditation, and another center, again very new innovative center for accreditation of veterinary facilities, which we set up in 2017 itself, but we went into a cold storage for some time. We rejuvenated this again in March last year, but COVID has thrown us back. But now again, a month back, we have started geared up, and now we are developing standards for veterinary hospitals and clinics, and a technical committee of eminent veterinary experts from the country have been assigned the task to look at it and start moving forward. On our laboratory accreditation board, which is chaired by Professor Vikram Kumar. He is a very senior scientist and a former director of CSIR National Physical Laboratory in New Delhi. We run different programs, medical laboratory program as per ISO standard 15189, testing labs 17025, and we started a new program as per new standard 20387 for biobanking. And when we launch in the month of March, we become the third accreditation body in Asia Pacific after US and China. And we are fortunate to have our first application from National Liver Disease Biobank, which is set up by Department of Biotechnology and Delhi government at Institute of Liver and Biology Sciences. And we also run a program for Clinical Establishment Act compliance for medical laboratories. As far as our accreditation board for healthcare is concerned, as I mentioned, chaired by Professor Misra, who's a former director of AIIMS New Delhi, an eminent professional in healthcare, set up trauma center in Delhi in AIIMS, and has many credits to him. So thank you so much for joining in, sir, once again. And so, as I mentioned, we are the fastest developing accreditation body in the world. We started with assisted reproductive technology, ART, IVF center program in 2017, and then added home healthcare, dialysis center, green healthcare facility, hospital certification program. We also run WHO patient safety friendly hospital certification program, program based on WHO standards, primary care clinics, ambulatory cares, telemedicine recognition program, telehealth accreditation program, which is very unique again for the first time in India, but also this is, I think, a full-fledged accreditation programs second in the world after Iraq in US. And happy to say that we have been asked to submit this standard as a base standard to ISO Technical Committee TC 304 to develop a new standard for ISO called telehealth management. And I have submitted this as a new work item proposal to ISO, which has been accepted by member countries, and now ISO TC 304 will be moving forward to work on developing ISO standard for telehealth management. And then comes the hotels and homestays accreditation program, which we are sitting here today to launch it. And then another program is coming up for launch maybe this month or maybe at the most next month, is for emergency department accreditation, which we have developed in last several months. And QAI is the first and only accreditation body in India having two standards accredited by International Society for Quality in Healthcare, ISQA. Our dialysis standard got accredited in 2019 in June, and then home healthcare got accredited in February last year in 2020. And home healthcare, as you know, is increasing, and COVID-19 has really moved home healthcare to the highest level of care. So we are really happy, and we are now moving for our third standard for IVF centers for ISQA accreditation and our organization as well. We are institutional member of International Society for Quality in Healthcare, also a associate member of Asia Pacific Accreditation Corporation, and institutional member of International Society for Telemedicine and E-Health. We work in a couple of countries, either hand-holding them to develop their standards or setting their accreditation bodies or running their training programs in different topics and subjects. So comes hotels and homestays accreditation program journey so far till date for launching. We begin within the last year in May, June 2020 by forming a technical committee of experts for that. Technical committee met several times remotely over email, over Zoom platform to discuss and come out with a draft in November 2020. So almost 6 months. They have really worked very hard and put up this final draft. And we went for public consultation for 2 weeks in November 2020. And then standards were finalized in December 2020. And so first edition was published in January 2021 this year. And we were waiting for launch this standard for a couple of regions. This has been, the postponed several times. But we find that this day, the World Accreditation Day, is the best day for launching any quality and safety standards. So we thought, why not this day? So we requested every one of you, and you are here. Thank you so much for joining in. And we already completed all the requirements for running the program, like writing all the documents which are required, assessor requirements for training, qualifying, competency, etc. And we are sitting today on 9th of June for launch of this program. We are really thankful to our technical committee who have really put all their efforts in developing these standards, chaired by Dr. Arati Verma, who is Senior Vice President Medical Quality in Max Healthcare. And she's today here for launching this. And Dr. Gaurav Tukral, Chief Operating Officer for Healthcare at Home. Mr. George Johns is the owner of Johns Farm and Home. Mr. Dilip Tommy, the General Manager of Rose Gardens Homestay in Kerala. Mr. Jatinder Sharma, Founder and Director, Consortium Resource and Inns Private Limited. Ms. Vanita Arora is Director, Housekeeping from the Park Hotel. And Mr. Ashish Makkar, Head Tourist Hostel, YMCA. And last but not the least, Jatin Kumar, who is the General Manager with Healthcare with Quess Corp Ltd as Member Secretary. And thanks to my colleague Rama, who has been providing the secretarial support to this technical committee. So our heartfelt thanks to all the members of this technical committee for their hard work, compassionate work for drafting these standards, and which are ready for launch today. So giving you the a little bit of outline of the standards. The standard framework is actually comprised of 11 chapters. And if you look at these chapters, they are really takes care of most of the things, if not everything, if I can say so, like governance and leadership, starting from the top ownership, the leadership, how they are, the governing the organizations, how they are managing the entire organization's responsibilities, their values, mission, vision, and ethics, core objectives, etc. And we have guest service management, how the guest services are being managed, starting from how they receive the guest, and then different services during the stay of the guest. Then guest recreational facilities might be anything related to recreation, maybe maybe what do you call it, a pool, maybe what do you call it, a playroom, or anything which you can't think of. I'm not the expert for that, but you're staying in a hotel. Many things which comprise of towards recreational activities and facilities. Housekeeping services, one of the most important thing as far as quality and safety, and particularly for COVID typing, starting from cleanliness, and then behavior of housekeeping staffs to ensure implementation of different protocols. So everything housekeeping, starting from the entry point to even guest rooms and everything around. Then food and beverage services, one of the important aspect of any accommodation, how food is prepared and taken care of, the hygiene, cleanliness, and on sort of things related to that. Then guest rights and responsibilities, of course, guests have certain rights which need to be adhered to, but they have also responsibilities to comply with. Then hygiene, safety, and infection control has given a very specific emphasis on this, because we are now in COVID times. Everybody's talking about safety, infections, and so a specific chapter to takes care of all hygienic processes and protocols across the organization, safety aspects of organizations related to anything which we are coming across to ensure the guests remain safe. And then infection control practices, prevention and control practices, whether it's the hand hygiene, cleaning hands, or you know talking about sanitation of the usables, and in the guest room, different items. So how they, even different touch points, and the handles, doorknobs, elevators, different points, how do you ensure that they remain clean and they are not become the carrier for transmission of an infection. And then facility and risk management, it's about the physical facilities, like the whole of the building, how this building is being ensured that remains safe for occupation, whether it's guests or staff or any visitor. And then is there any risk identified? There may be disaster, there may be man-made natural disasters, fire safety protocols for fire safety, or maybe earthquake, anything which can be can happen to any building. So all those things has been taken care of in this. And then we have, of course, one of the most important thing, which is human resource management, the personnel, the staff, who runs the organization. So how they are, starting from their recruitment and their, professional developments. They are taking care of different policies and procedures. So training, recruitment, professional development, continuous professional development, ongoing evaluation, and requirements for training, training, and everything is covered in human resource management. And then information and communication is again very important, particularly when you're talking about the caring the guest. So how the information is being collected, disseminated, stored, retrieved, and discarded, or dispose of when you don't need it. And then how the communication is flowing in entire organization, whether it's from reception to guest room, or vice versa, or any part from that accommodation to any part to communicate within the system. And then very specific chapter, last 11 chapter has been kept for COVID management, COVID-19 management, though many aspects has been covered in infection prevention chapter, but a very specific requirements have been put for COVID-19 management, guidelines from different organizations nationally, from Ministry of Health, but internationally, global organizations, best practices have been put into this. So in all, 11 chapters come out as different standards, total 56 standards. And these 56 standards have been further divided into 344 criterion. And these criterion are basically are basically the measurable elements, the components which can be measured. So each standard has been divided into, say, one standard divided into 3 or 4 or 5 criteria, and then all together they form a chapter, and then entire 11 chapters form the entire standard. So this is This is the framework which the technical committee has thought of after a lot of deliberation, discussion, reference from several national and international documents, which we could have come across, though we know that we could not come across any comprehensive accreditation standards which have been developed by anyone else, but we have come across certain standards from associations, from some organizations for accreditation. So, and of course, building on our expertise on healthcare accreditation standards, which we have developed. So this has been the framework. And I'm happy to say, and today is the World Accreditation Day, and this year's theme for World Accreditation Day is accreditation, how it supports, supporting the sustainable development goals. So it's very timely that to inform you that these standards for hotels and homestays certainly support the sustainable development goal number 3, which is good health and well-being. Goal number 6, clean water and sanitation. Goal number 8, decent work and economic growth. 12, responsible consumption and production. And last but not least is climate action. So there are requirements put into the standard about the green, green environment. How you ensure that you save energy and make sure that you don't contribute towards more carbon emissions to the environment. So these 5 sustainable development goals are supported by these accreditation standards. So very happy to say that on World Accreditation Day that we also supports it. This is the process of accreditation. We have a very comprehensive mechanism of self-assessment based on the self-assessment toolkit, which is designed on the standards, all the requirement of standards and criteria. So organization has to complete the self-assessment tool and see where they are, and then work on those areas where they are not in compliance. And once they feel that yes, they are into compliance substantially, and then they apply on a prescribed application form, self-assessment toolkit, any reference documents, because that will be asking different policies and procedures. So all documents and fees they would submit to Secretariat, where we will review the documents, application for its completeness, and if there are any deficiencies, we will request the organizations to provide and fill those gaps as well. So, and then we will review the documents, self-assessment toolkit, reference documents, and then we move on to the next stage for evaluation. So it can be any combination, or usually it is to be an on-site, but COVID has changed the scenario in last year and a half, and people have moved, different bodies have moved for virtual or remote assessment, even hybrid assessments. So depending on the circumstances and based on our policies, which we have already set for ourselves for those conditions, there would be an evaluation by a team of experts, and they would conduct that assessment for days, depending on the size of the organization, in number of beds, their guest rooms they have, and then they generate the assessment report and any deficiency if exists in relation to the standard. These reports come to the Secretariat, we review it, and again, if there are any, so they score themselves for 0, 5, 10. So if there are any partial compliance or non-compliance, they receive 0 and 5 in the scoring. They need to work on those items, prepare an action plan and corrective action, and submit back to us within 30 days. And once we get this and we check the scoring, and if they meet the minimum scoring requirement, we move forward to the accreditation committee, and then accreditation committee will review all those documents, reports, score mechanism, and would recommend to the board for accreditation. And then we put up to the chair for approval, and then we issue the certificate, which is for 3 years. And then middle cycle of 15 to 18 months, there is a surveillance assessment to see the compliance, continuous compliance with the standards. And then 6 months before the expiry, there is a renewal process for this. So this is the entire process for accreditation, and it's a two-way traffic. Means we send the information to the organization, they can send to us. So it's not just one way, but we interacting with the organization at all stages. This is our mark of sustained quality, and we are branding it like Safe Sojourn. Safe Sojourn means safe stay, because this stay related to the guest stay in hotel and homestays or different accommodations. So we believe that this accreditation would really help and support organizations to build the confidence of their guests and communities. And so this is the mark of Safe Sojourn as a branding. So thank you very much for your patience hearing and allowing me to share what we have done so far in terms of the standards development and standards process and so on. So thank you very much. With this, now we move on to the next item. And now I have the pleasure of inviting our guest of honor, Dr. Jatinder Singh. He is the director of PSD Chamber of Commerce and Industry. So I would request Dr. Jatinder to please share your perspective on this today. So over to you, sir. Thank you.
Thank you, Dr. Rana, for inviting me on this very important platform. And as we are celebrating the World Accreditation Day, so it is nothing, more can actually please me to talk about this tourism industry, because in fact I'm heading the vertical of tourism in PhD Chamber of Commerce and Industry. So I'm thankful to you for this gesture. And as we know that accreditation is one of the most effective tools for assuring the competency and trust in a wide variety of areas of our economic and social life. And right now, if we see this travel industry and hotel industry, particularly when we talk of hotels and homestay, so one of the industry's biggest challenges is basically to reinstate a person's confidence, a traveler confidence, to basically have a very safe stay. And as we know that if we see this hotel industry, every interaction now that is going to happen is basically a moment of trust. It's a moment of faith, because now the industry as a hotel, we have to basically physically demonstrate that the customer can actually, trust us. And as we know, this COVID-19 pandemic has hit the hospitality industry very hard. And there was a brief recovery during the months of unlocking in late 2020 and early this year. And the sector is again in this ICU under the impact of second wave. And in fact, our country's hotel, occupancy reached a high in February, somewhere close to 53.9%, which looked to be a solid progress towards recovery, as the monthly level was roughly 73% of the 2019 in the same month. And by April this year, this occupancy came down to 31%, and now recently, ending this week of 30th May, it is just 21.5%. So in fact, the COVID-19 pandemic, it has crushed the hospitality industry, not in India, but basically worldwide. But at the same time, we know that we have great resiliency. Like I'm sure that as soon as the number gets down, as soon as the confidence is restored, and as soon as the hygiene, safety, and infection control mechanisms are in place, definitely there will be a big boom to the hotel industry and homestay industry, because people are very willing to move out. And as we know that the standards accreditation, particularly pertaining to quality and safety, are one of the most important benchmarks for hotel and homestay. Because the basic idea for every traveler is basically to get a very clean and affordable place. And it's a big opportunity for our Indian customers, as well as the global customers, once the flights start reinstating, to have sort of a taste of our own culture with high degree of quality and safe stay. So accreditation standards, definitely it helps to retain customers. It is also enhancing customer satisfaction in many cases in service industry. It also helps to maximize the frequency of customer visits, of transactions, and also like at the same time generating more positive word of mouth by the way of advertising. So right now in this era, I'm sure that accreditation standards are must, as the customers, I think more than ever, the customers are actually going to be looking for the seal of approval in terms of basic hygiene, infection control, and safe stay. And as we know that many hotels are experimenting with new technologies, like many hotels are using electrostatic sprayers to spray lobbies with disinfectants. And also, many hotel brands are also encouraging guests to access their rooms via their mobile phones. And in fact, we definitely will see a greater resilience in this emerging market in the next few months. And in fact, until March of this year, India and China were trading places for the highest intention to travel. So while the current travel sentiment remains somewhat clouded, but we are sure that there is definitely going to be recovery, and there is definitely light at the end of this tunnel. So accreditation standards are must because it will definitely give a boost to the corporate reassurance, because many corporations, they are demanding reassurance before allowing their own employees or business travels to stay in different properties. And also standard framework will definitely allow to establish a system of registration, information, linkages, and mutual assistance in a very clear and transparent manner, and that will actually enhance the value of safety, and it will improve the quality of services which are rendered by such hotels and homestays. So this is going to be a big, or a significant differentiator, because this will actually demonstrate accreditation to a global standard. The framework that you have made, I'm sure that this is going to be one of the milestones in terms of quality standards, because the hotels then can actually reassure travelers of their commitment to a very high standard of safety and security in terms of infection control mechanism. And at the end, I'd like to congratulate QI and particularly Dr. Rana in particular for launching the accreditation standards for hotels and homestays. In fact, in all these 11 chapters, right from governance and leadership to this COVID-19 management, they aptly cover each and every aspect of the hotel and homestay industry. And I'm sure that with greater integration and greater acceptance of the travel and hotel industry for these accreditation standards, I'm sure there'll be a lot of moral boosting for the customers as well as the industry. So thank you very much. Thank you QI and Dr. Rana again for giving me this opportunity. Thank you very much.
Thank you so much, sir, for your encouragement and encouraging word. Really means a lot when coming from the industry associations about the importance of the standards, basically how it can boost the morale of people, not only who are serving, but the people who are coming and staying, because COVID-19 has thrown up all things into the mind that can be remain safe and going to visit a hotel to stay, because there are a lot of things. You are not like something you buy and go, but you stay for some time. So thank you so much, first of all, for making your presence here on this day, as well as your kind words, encouragement, and we look forward to working with you in time to come after this launch, that how we can collaborate, work, and make it happen, reach out to many. It's like creating awareness. So definitely I will reach out to you after the webinar, and we look for the opportunity to working with you. So thank you so much, sir. Moving on to the next now, our next guest of honor, Mr. Anil Jauhri. He's a well-known personality in the world of accreditation, and I know him for last 20 years, of course, in different roles and capacities. So Mr. Anil Jauhri is formally, actually, he was the CEO of NABCB in Quality Council of India, and has been pioneer in bringing out many standards and schemes under NABCB fold. And he also is international expert for accreditation, and most prominently, he's accreditation panel member of United Nations Framework Convention of Climate Change, UNFCCC. With this, I would like to invite Mr. Jauhri for his address. Over to you, sir. Thank you.
Yes. Good evening, Dr. Rana. Thank you very much for inviting me to this very important. Can you hear me?
Yes, sir. Yes, sir.
Okay. So thank you very much for inviting me to this very important occasion. I should first actually compliment you on your courage, given that hospitality industry is in such a shape today, as the previous speaker also said, and I was listening to a hospitality expert a couple of days back, that after bouncing back during the period of December to February this year, the industry has suffered another shock with the second surge and the lockdowns. So to launch a voluntary scheme at this time, when the industry is struggling itself, is actually an action of courage. But equally, there could not have been perhaps a more appropriate time to come up with a scheme like this, because as again the previous speaker was also highlighting, I mean, I look at myself as a common man who might be looking to travel and stay outside, and would be concerned about the assurance that the hotels provide, how safe they are today. I mean, we only thought of, in days gone by, we only thought of the star ratings of hotels. We of course expected the basic hygiene as we would expect in a restaurant if we go, or a hotel we go, but nothing special in that sense. The focus was not on hygiene and safety at all in that sense. And today the focus has changed, and more than the facilities, I would be looking at whether this place is safe for me to go, and is it practicing the necessary precautions which are needed to make sure that uh, we do not run into trouble after a stay there. We have heard instances of even in very well-known hotels. I remember in Chennai some months back when people tested COVID, number of people tested COVID positive. So this will remain a concern. Now, I'm sure you have very eminent doctors around, Professor Misra or Dr. Arati Verma, who are more qualified to speak on this. But as a layman, again, my own assessment is that COVID is here to stay for some time. It's not going away easily. And therefore, and the precautions associated with COVID will stay longer than COVID stays, because some kind of assurance as far as hotels are concerned is very, very necessary, because travel is going to be there. And travel means not merely airlines or railways or road travel, but also means hotels. So the assurance that the standards bring in and the process of accreditation brings in has acquired to me a new importance and new dimension as far as hotel industry is concerned. Of course, in last few months, I've been seeing some schemes coming up in relation to hotel certification or accreditation, as you may like to call it. And I'm looking at Ministry of Tourism on developing some kind of system whereby such initiatives can be recognized, rather than each struggling in the market for his own acceptance. It would be a great help. I have been actually informally talking to some officials in Ministry of Tourism and telling them that ministry should be like a granddad who lets everybody prosper as long as they meet certain basic requirements. In international terms, we call it benchmarking of schemes. And I'm expecting that in course of time, some kind of benchmarking system would come. And therefore, schemes like these would get better recognition. Otherwise, I'm sure Dr. Rana knows the struggle of a voluntary scheme. I know the struggle of voluntary schemes. I know the struggle of voluntary schemes created even in a governmental organization like Quality Council of India. So I'm sure Dr. Rana recognizes how difficult it is to make your schemes acceptable, especially when you come from the private sector, the challenge you face in terms of governmental acceptance as well. But there are ways of doing it. If you refer to a strategy document which was prepared by Department of Commerce way back in 2018, there are ways suggested there. I was part of that strategy document. Dr. Rana is aware. So let's hope that there'll be an ecosystem where any good scheme which can assure safety for the people gets a recognition. And I'm looking forward to that stage coming in Indian ecosystem, where any such scheme, which the kind of scheme Dr. Rana and QAI are launching today, gets that kind of recognition. Because ultimately, we have to make sure that people are safe, and whoever can guarantee that safety deserves recognition. That's how I view it. And let's hope, I do wish all the best to Dr. Rana's newest initiative. And I look forward to a time when we would, as I said, have an ecosystem where anybody who does good work gets recognized. Thank you very much.
Thank you, sir. Thank you so much for your kind words and words of wisdom, I would say. Yeah, very well. And that is what we keep talking about, recognitions and credibility. And that's what the standardization is in the world of accreditation, where we based on all the requirements and compliance to the specific requirements which we place for any organizations to meet. So thank you, sir. Thank you very much for joining in, as well as guiding us. And definitely we would continue working together and seeking your advice in time to come for making a program a success. Moving on to our next agenda now, I'm very happy and honored to invite Dr. Arati Verma as our chief guest today for launching this standard. The Dr. Arati, as I mentioned in the beginning, is basically chair of technical committee for hotel and homestay program, and she is the senior vice president medical quality in Max Healthcare, a very renowned name in healthcare quality. And we know each other for last 16, 17 years. Since 2006, I remember very well when we kick off at NABH and Max Hospital came in, and then got accreditation from the hands of our late honored president, Dr. Kalam, on the occasion of a great ceremony. So thank you very much, Dr. Verma, for leading this technical committee. And the result, the fruit of the work of committee is here today in your hand to launch. And before we launch, and may I request you to please give your launch address. Over to you, madam. Thank you.
Thank you so much, Dr. Rana. It's a real honor and privilege to be here with all these esteemed panelists and people who are on the Zoom. So I have heard with a little somber mood about the director and Mr. Anil Jauhri's mood and the mood of the nation. But I want to start with a sense of promise and potential, and say that this pandemic has caused a deep setback to everybody, personal as well as industry across the world. A very deep setback, which has also impacted economically everybody. But I also say that it's a very temporary one. Like any pandemics, they have to fade out. So we must look beyond. We do our best during the pandemic, but wait that it's going to pass off, and we'll be into a good world, normalized, maybe a little less normal than before, but yes, we are going to get back to our routines, and people are going to travel and stay in hotels. So this is a wonderful time to launch these standards. I was also updating myself, there's a very recent report by the India Brand Equity Foundation, where they have given data that India has more than 16 lakh hotels. Not just, I'm not even talking about homestays. So look at the potential, 16 lakh hotels as of November 2020. And I think we are very proud as an industry of the hospitality sector, because Indianness and seva bhav and taking care of guests is part of our DNA. And we are growing at a rate of the hospitality sector is the fastest growing service sector in the country. And projections by IBF are that we're going to have many more international tourists coming to India, more than 35 million in the next 7 to 8 years. And the domestic sector or travel intent is also very, very strong. There's going to be a growth of more than 6% of this industry year on year as we move forward. So with that, I think this launch of these standards to strengthen, to bring a greater sense of pride and confidence in the industry across has happened at the right time and in a very, very good manner. So my congratulations to you for the vision that you carry, Dr. Rana, for addressing and taking these steps, the courage and the effort that you and your teams are putting in to move forward despite everything. So hats off to you. The standards, as I know, although me and my team have looked at it, I must say that it's a very comprehensive 360-degree view, totally customer centric, but at the same time digging deep into all areas. And we have also addressed the COVID precautions that need to be in place, which can be added on during the phase of the pandemic. And they can be, kind of minimized once the pandemic phase is over. But the safety, the customer centricity, and the staff, build up is so very well addressed in the standards. I hope that once the launch is over, again, with the hope of promise and potential, that we have these standards disseminated across our country, maybe across the Asian region. The potential is so huge, because I don't think any other country has such beautiful standards so far. So at least in the Asian region, we should aim to reach for the sky. They should be disseminated, adapted, and bring, a third party or external reinforcement of your standards is a great, reinforcement of what you're doing. It has a ability to bring in continued focus on, quality and safety in your organizations, helps you to sustain what you are doing, helps you to share learnings from each other, so that the industry at large continuously improves and upgrades, gives you the ability to benchmark. So, there are so many benefits of going in for accreditation. Believe me, when a hotel gets the certification, the sense of pride and confidence that the teams have is something that is so heartfelt. It can replace nothing else. So with that, my compliments to Dr. Rana for this momentous achievement. And I now, invite you to launch the standards formally. Thank you so much.
Thank you so much, madam. Thank you very much for your address and the words which you have given to us would certainly lead us, guide us, throw us on the path of continuous compliance, continuous improvement, for looking at how we can ensure these stay facility, accommodation facilities always remain safe place for anyone who is visiting, whether guest or staff or any temporary visitor for even for a moment. But more because staff is also valuable, and healthcare has shown that how important it is to take care of your staff if you want your patient to be safe. So similarly, if you want your guests to be safe, you have to ensure that your staff remains safe. So thank you very much for your inaugural address. And with the permission now, the house from yours, ma'am, I will request Rema to please play the video for launch. Over to you, Rema. Thank you.
Yeah, thank you so much, sir. I will just share my screen to all of you.
Thank you so much, Rema. Thank you very much for making this wonderful video. So all credits to Rema and the colleague, just me, she prepared. So thank you very much for launch. And with this, before we move on to the next session of the day, may I request everyone to, if you can, to switch on your video so that we can click a photograph for everyone around. If you can switch on your videos, please. It's a good moment that we can click. Rema, please click the screen. Everyone, may I request everyone to please, yeah. Smile, please. Rima, when you're done, you can tell us.
Okay, 3, 2, 1, smile. Okay, thank you so much.
Okay, great. So thank you so much, everyone, for making this, and thank you, the technical committee. Thank you, Chair Professor Misra, for guiding us all through, all the board members guiding us all through for making it, and experts like Mr. Jauhri. We keep talking, discussing pros, cons, challenging each other all the time. So it's all fun and work. So thank you, everyone, for your time. And with this, now we move on to our next, again, very important agenda for us, which is about signing an MoU between QAI and Quess Corp Ltd, and launching a specific training program as well. So just please, and for this, I welcome once again our special guest, Ms. Rupal Sinha, CEO of Quess Corp IFMS, Quess Corp Ltd. And before I hand over the floor to Rupal for her launch address for the course, and as well as announcing our MoU, let me please share with you few things for your information. Please allow me to share my screen with you. Just a moment, please. Just a moment. With my slide. Launch event. Okay. Yeah. Okay, is my screen up for you all?
Yeah.
Great. So thank you very much once again, and welcome you all to this very unique session again, which is signing MoU with Quess Corp and QAI. And so joining hands, QI, which was set up to create an ecosystem of education, training, quality improvement, accreditation, certification. And Quess Corp Limited is India's leading business services provider and largest private sector employer. Quess offers a host of services to help organizations manage their non-core activities in the areas of workforce management, operating asset management, and global technology solutions across industries and geographies. So we are very fortunate to have an MoU with Quess Corp. The scope of MoU is to explore collaborations with public-private sector for capacity building and knowledge sharing, jointly developing and delivering training courses, whether it's e-learning, online, remote, on-site, in different sectors, certifying the trainees through joint certification, jointly explore project funding opportunities from global donors like Global Fund, USAID, Gates Foundation, UN agencies, and so on, jointly publish the promotional flyers, brochures to create awareness, and also communicating the activities which we would be doing under MoU, jointly explore any other new opportunities which we feel like to go into it. The sectors we would like to cover, but not limited to healthcare, education, banking, IT, retails, hotels, airports, and refineries. And I'm happy to say that Quess Corp is already into all these health in these sectors, providing their services. So we have an opportunity to look into these sectors and look for that what we can do in differently. What are the areas of MoU? So we have certain areas identified at the moment, but not limited to. We can continue adding to these areas. To begin with, infection control and prevention, accreditation and certification, communication skills, soft skills, leadership skills, integrated facility management, or any other customized topic which we feel would be the need for health. This MoU again, and as I mentioned in the beginning, World Accreditation Day, how accreditation can support sustainable development goals. So this MoU is going to support these three sustainable development goals: good health and well-being, decent work and economic growth, and partnership with the goal. So 3, 8, 17 SDGs would be supported through this MoU. So second part of this session of this is also launching a training course, which we have developed in collaboration, which is basic emergency. Just a moment. basic emergency medical responder training program based on methodologies, or whether it's online, videos, presentation, interactive, self-paced learning with target audience of trainers, managers, executives, supervisors. And there are a couple of modules which have been put into this, taking into consideration current requirements and also a little bit of what we can see in future. Hand hygiene, use of PPE, monitoring of patient vitals, when to seek medical assistance, hazardous materials handling, clinical severity, mild, moderate, severe patients, pulse oximetry, which has become now a very norm in COVID times, oxygen therapy, use of oxygen cylinder and supplementary oxygen devices, COVID-19 overview, of course. How do I know if it's a cold, flu, or COVID-19? Assessing COVID-19 symptoms, prone position for COVID patient, boosting the immune system. And then first aid for medical emergencies, which comprise of several things, I mean, like fainting, seizure, stroke, diabetic, burns, snake bite, and several others, which would be covered in the modules which we have designed this with. So this course is actually targeting first training the trainers, and then going deep down to different industries, different sectors, to prepare manpower, skilled manpower, to ensure that a patient who is requiring at any place, whether it's a refinery, maybe airport, where healthcare facility doesn't exist, but this person can help saving the life of someone. So this is what we aim through this MoU. And for this announcement for our MoU and launching this course, I have the honor to invite Ms. Rupal Sinha, first for her special address on this occasion, and then her permission to launch the course. Over to you, Rupal. Thank you.
Thank you so much. Good evening. It's not always good to be the last one to speak. I'll try maximum to be precise and to be engaging. But first of all, congratulations to you, Dr. Rana, Mr. Singh, and the entire technical committee for launching this hotel and homestay accreditation. 56 standard protocol, as I heard, and 360 plus standards. I think that's enough for building a confidence, and hotels to adopt this kind of a standard should engage people and attract them for a real good, healthy, hygienic stay. So congratulations to the entire team. Well done. Having said that, we all are suffering from COVID. We heard from the prior people also talking. 2611 taught us the fresh perspective of how security needs to be relooked, both at the enforcement level and at the private security level. COVID has definitely taught us to look at the perspective of how health and hygiene needs to be given a fresh look in the new normal, because things are going to change. There will be a hybrid model where people will be working from home, on-site, social distancing norms need to be maintained. And today it is COVID, tomorrow something else. But this new structure of having the on-site management of any facility, anywhere we work, whether it is healthcare, whether it is corporate, whether it is IT, whether it is in a retail store, they all need to be given a fresh perspective. And that's where training and health, hygiene, and all the three programs that you mentioned about the three protocols of 318 and 17, good health and well-being, sustainable solution, skilling and equal opportunity, diversity. These are very, very important programs, which at Quess we have taken it very, very seriously. For those, who, Dr. Rana, you spoke about Quess, and you gave a very briefing. We have a workforce of 340,000 people employed, out of which maximum sits into India. A young organization, 14 years old organization, we are listed at Indian Stock Exchange with 11,000 crores of the revenue for this year. So people are very important. Our major delivery goes from workforce, and having a quality delivery for our customer and for our own people's safety and hygiene. It's very important that these guys are today, we retool them, repurpose them, retrain them to meet these COVID protocols. And that's why, the intention to collaborate with QAI to bring these kinds of HSE focus, not only within Quess facilities, but also at our client's facility, vaccination drive to ensure the health and safety of our own people. And today we are also running, we are in conversation and we are also running vaccination drives for our clients, facilitating them to get to collaborate with the hospital to ensure, their all employees are vaccinated. We are assisting them there. Hygiene and standard at client location with new technologies, quality and accreditation becomes very, very key. If we go and say, and if the organization today say that we are a QAI sojourn, what I just saw, I think that speaks of itself, that all the quality standards, hygiene, health, safety, and security at these facilities have been met, which also boosts the confidence of employees to return back to work. So these are some of the protocols we are really looking forward in collaboration with QAI to bring those standards, bring those trainings not only within our own system to our own workforce, to our own trainer, but we also want to bring these training protocols to our customer base also. Their security experts, their security managers, their facility managers, their supervisors, everyone, and also generally to the employees, what protocols they should handle while they are on site, after vaccinated, coming back to the work, what protocols of hygiene they should maintain while they are on site. Sustainable solution is a very, very big drive for us. We measure carbon footprint. We work with clients very closely to ensure that the green energy is maintained, reduction of carbon footprint. We have incubated a lot of startups this year. In fact, 12 to 17 months, we have incubated a lot of new technology startups to ensure that we have those technologies which can bring a PM 2.5 level of air quality inside the premises, because maximum infection today is not outside. It's indoor air quality that needs to be protected and given. Lastly, on the skilling, as we spoke, any goals, whatever we spoke about a lot of goals today. No goal can be achieved till my workforce or people who are delivering is not skilled. Therefore, skilling is very important and training is high on agenda. Jatinder, who is the secretary on the technical committee, he heads our training and his role is no more limited to healthcare protocols, but to ensure that all these training and reskilling, repurposing our own people so that our security staff could be the first emergency medical responder. Our people are trained into how to assist in a vaccination program. We can on-site teach them how an isolation room works, because today our people are deployed at majority at healthcare, many hospitals. And these training programs have really helped us. And tomorrow they carry a badge of certificate that QAI and Quess together. We have trained and repurposed our housekeeping guide to manage an isolation room. I think we will be achieving lot into the industry. So that's exactly is our goal to serve the people across, whether as an individual, as fellow people, as our employees, to our customers, what all through these accreditation programs, through training, through repurposing them, how well we can support these troubled times, these unprecedented times, and come out, supporting each other and having a much better hygienic environment. So that's the goal. With that, Dr. Rana, I request you to, give a go ahead and we sign off our collaboration, and let's make the world much better. Thank you.
Thank you so much, Rupal. Thank you very much for your kind words and really guided through what should be in place. And the workforce is the prime important, because they are the one who are driving everything. Means if we are ensuring their safety and their quality of life, I think we are going to achieve all the common agendas and goals which we set for everyone around the community. So thank you so much. And QI is really honored, delighted that Quess Corp has accepted our request and enter into MoU. Thank you, Rupal, to you. Thank you, Jatin, for all the efforts put in. And we are sitting today and thank you very much for now announcing the launch. May I with this request my colleague Verma to preview launch the video, please. Over to you, Rema.
Right, sir.
Thank you.
Thank you so much. I am just putting up the video.
Thank you, Rema. Thank you very much. And once again, thanks, Rupal, for your presence and signing off the MoU and launching this very first training program under our MoU. Thanks, Jatin, for making it dual capacity. Thanks for your all hard work making as a member secretary for home healthcare, home and home stays. I always mixing with the home and healthcare. Now it is a hotel actually. It's not home care as well. It's hotel and home stays standards. So thank you. Special thanks to Jatin for such a hard work, passionate work, which sometime I was feeling that I am the one who working very hard, but I think he forced me out. So thank you so much, Jatin, and special thanks to
Dr.
Rupal
Rana.
for making this day. So thank you very much. And I think with this, I thank Professor Misra, our honored chairman, for all his guiding work and always encouraging thing. Sometimes when we go into different areas, he say, "What is this?" And then he agreed to that and then move forward. So thank you, sir. Thank you very much for your presence, and thank you, Dr. Arati, for you, Jauhri sir. Thank you very much, Dr. Jatinder. And there was my guest. I think he just left. I just forgot Dr. Ahmad. He was here from from Oman. We are also having an MoU with an organization working in Oman. So thank you for that. Priya joined. Priya is basically working for Qualistar. She is one of the first starting certification program for hotels. She did a couple of audits. So I came to know Mr. Jauhri introduced me to her, and I had a chance to listen to her, I think a day earlier. So thank you, Priya, for joining, and thank you each one of you, Tarni, Alok, my friend from QCI. Thank you so much, Dr. Nawal, Dr. Jatin, Sabuddin, Sabah, everyone, Madhbi, Ajay, Ravish. Thank you everyone for joining in and making this for us a very, very special day, to be very honest. For us, numbers are not matter, but the interest, passion, commitment is matter. I believe in that if I want to do it, I will do it, because I have the support of people like you. So thank you very much. It's not me, it's all of you. Thanks to Rema, who has been a very guiding force, and everything she has been managing behind day in, day out. So thank you everyone, and I think we look forward to continue working with you all. Not just the end of this is the end of the event today, but this is the beginning of a great relationship which we are aiming to achieve in time to come. Whether it's healthcare, whether airport, a refinery, we will be everywhere. In one form or the other form, we will be there. That's QAI, that's Quess Corp. Today, we're signing an MoU. So thank you so much for that encouragement. It's an honor, an honor with signing MoU with Quess Corp, the largest private employer, 3.6 lakhs people employed in different sectors, it's an honor, madam. Thank you so much, Rupal, for making it. Thank Jatin. And time is, yes, we have to wind up. Thank you, sir. Mr. Sir, thank you so much. You're really an inspiration to us.
I think I must give you all the credit that despite and in spite and against all odds, you were able to gather all this team and they worked hard and they delivered. You are right. This is just the beginning. A long way to go in India when we talk of quality. And we hope that with these small efforts, we'll achieve big in coming times. So thank you so much, everyone, for coming on board and supporting Dr. Rana wholeheartedly. Thank you. Take
Thank you very
care.
much.
Keep safe.
Thank you so much. Take care.
Thank you.
Thank you.
Thank you so
Bye-bye.
much.
Thank
so
you,
much.
everyone.
Bye.
Bye,
Bye,
everyone.
everyone. Thank you. Thank you, everyone. Bye-bye.
Thank you, Rupal. Thank you,
Thank
Dr.
you.
Arati.
Thank you.
so much.
everyone.
Thank you, everyone.
Thank you.
Thank
Thank you,
you and stay
Verma.
safe. Stay safe.
Stay
Thank you,
safe.
sir. Bye, everyone.
Bye-bye.
Safe.
Bye-bye.
Stay safe. Till we have the accreditation done, stay safe.
Yeah.
Thank you so much.